I'm Dr. Rima Laibow MD, and I am the medical director of the Natural Solutions Foundation. Our primary website is preventgenocide2030.org because we are interested in, you guessed it, preventing genocide. And as you know, the UN's Agenda 2030 is very much a depopulation and enslavement and transhumanization agenda to which we say not only no, but hell no. And there are a great many things that we can do, that we must do to stop the forward march of this insane and evil program. Now, one of the things that we must do is learn from each other. And I am so delighted today to welcome as my guest Professor Anita Baxas, MD. She is in the United States, although I think she didn't start out in the United States. And we're going to hear about her adventure and journey. I've been following Dr. Baxas's work for some time, and I'm absolutely thrilled to be able to welcome you to the show. Hello, Dr. Anita.
Hello, Dr. Rima. Thank you so much for having me on your show. It's so important that the information gets out there and that we share what we know.
Absolutely. Well, tell us a little bit about yourself, where you have come from, how you got there, what you're doing.
Well, I was born in Switzerland, in Basel, Switzerland. I'm the oldest of three. And when my youngest sister was born with Down syndrome, my dad was a general practitioner at the time. He was told by the chief pediatrician in the children's hospital, whatever you do, do not do cell therapy. There is nothing we can do. And my dad was always very open for new things. So he figured, well, cell therapy, never heard of it. I got to find out more. And he went to Germany to Professor Franz Schmid, who has been using this to treat Down syndrome children as well as others. And he learned it and he's treated my sister every 6 months with cell therapy injections. And it kept her from getting the severe infections that they usually get. It helped her cognitively and develop more healthy than children who did not get treatment. So anyway, this got him also into
Well,
other.
I have to stop you and ask: Were these were these stem cells? Were these cell isolates? What kind of cells are we talking about?
That was back in the early 70s, so stem cells didn't exist. Those were fetal cells from unborn calf and
Oh, okay.
that were used at the time. And it got him into other modalities of alternative medicine, like orthomolecular medicine, chelation therapy. And then in the beginning 90s, into hormone replacement with the bioidenticals, but also with human growth hormone. We were really the first clinic worldwide using human growth hormone for anti-aging treatments, but also to help certain patients with MS and Parkinson's or muscle wasting. Then 1995, my mom got angina and she had an angioplasty done down in Miami where they were staying at the time. And 6 weeks later, the angina came back. Meanwhile, they flew back to Switzerland. She had another angioplasty done. Took 6 weeks and the angina was back. And that's around the time we heard about this old remedy from Germany, phosphatidylcholine, that we then later developed into the Plaquex treatment. So I studied medicine growing up with alternative medicine. I accompanied my dad to the big Baden-Baden conference every year in Germany, where they teach chelation and many other modalities. Before I went to medical school, and it was a little difficult getting through medical school with all the allopaths. I was pretty known to be doing these kind of treatments. So some professors really didn't like me and they kind of tried to flunk me, but they did not have the backbone to give me a below passing grade. So after medical school, I spent a few months with my cousin, who is a pretty famous ENT head and neck surgeon in Greece. And I went directly into our office that my dad had because I couldn't fathom doing allopathic medicine in a hospital. And we were at the beginning still a general practice office, and then on the side we had the other modalities because health insurance obviously didn't pay for those. So we had like a split office. And in 1999, I decided I'm done with general practice. I just want to do that and further develop and research the phosphatidylcholine, the Plaquex treatments. So in 2007, Big Pharma, which you know probably is located in Basel, Switzerland, like Novartis and Hoffmann La Roche, they did not like Plaquex because it balances the lipids, and the statins had come out a few years earlier. So they instigated the Swiss FDA to rate us, and within 10 days, I left the country. I had to leave everything behind and I moved to Miami, which has been my second home since birth. And we had to start all over. But meanwhile, the Plaquex took off the past 10 years. More and more clinics are using it. And it's because of the Plaquex that I started investigating what was in those COVID injections. And the first thing I found out from La
Wait,
Quinta.
wait, wait. I have to ask you to tease that apart. You were doing the Plaquex, and I know you're going to be telling us exactly what Plaquex is in part of your talk with us today. But how did what you were doing with Plaquex translate into what in the world is in these injections? What was the bridge?
Because I found out the graphene oxide is one of the ingredients
Got
in
it.
the COVID jabs that La Quinta Columna found out. So I did some research on what is graphene oxide, what does it do to the body, and one of the things, besides many other things, is it's sharp as razor blades, as
Right,
Andreas Nowak put out while he was
right.
being arrested by the police on a live podcast. So I'm thinking, okay, no wonder people are getting clots. It's damaging the endothelial cells, the inner lining of the blood vessels. And Plaquex is a cell membrane therapeutic. So I made the connection. Okay, Plaquex can help here. It can repair the damage. But I also knew in my gut that this was not enough. So I continued researching what else is in there. And I started contacting many colleagues that do alternative integrated medicine, asking them, what do you do for your vaccine injured patients? And I started putting together a program, pulling in all the modalities they're using. And finally now we just started opening a clinic in West Palm Beach where we want to employ these modalities and do further research. We're also part of the University of Health and Spiritual Sciences, that's in New York. And a big part of the clinic will be the research because my objective is to find the most necessary treatments to get people better and nothing extra unless they can't pay for it, because many people are so disabled they can't work, they don't have the finances to pay tens of thousands of dollars. So I want to get it down to the most essential that they need to get better, be able to start working again.
Outstanding. And so is your clinic operating yet?
It's open, but we haven't
It is.
treated vaccine injured patients yet because it's open very, very recently. And it's
Mhm.
still in the organizational stage at the moment.
So tell us more about what you found about the jabs and what can be done to heal the so far surviving billions.
Right? Okay, so I can share my screen to go to the PowerPoint.
Yes, please do.
Let's see. Okay, it's a little slow here.
Okay. We, I don't see the entire slide, so I'm going to adjust this to. Okay.
You see it now?
Yes, yes.
Okay, so yes, the objective was to find out what is in those shots and that causes disease and death, and how do we fix it? Now, first of all, I think most people, well, the people who follow you will know the current
Absolutely.
based on the Veris report alone, which only reports between 1 and 10%, according to a Harvard study, and probably even less in this case, it probably killed 20 million people worldwide and injured about 2 billion people. And then there's a report of life insurance companies that saw an increase of 40% in deaths of people 18 to 50 years old. And this, they say, is a 1 in 800-year catastrophe, 12 standard deviations from the norm. In the UK, the government published horrific figures as well. 1 in 310 people died within 1.5 months of receiving those shots. Those are numbers from 2020. Meanwhile, I'm sure they're much higher. Excess deaths in the US, over 1 million people. Then excess deaths in people 65 years or older in the US, which is massive. And these are numbers from 2024. Then we have fetal deaths, and I believe Dr. Thorpe did a big deep dive on the fetal deaths and disabilities and also infertility that it causes. Then the stillbirth.
Equal to, I think it's important for people to know that Dr. Thorpe's very careful research has shown that that effect that you just showed in that slide is equal to the effect on first trimester pregnancies of drugs used to induce abortions.
Oh, wow. Yes, I can
Yeah,
believe that.
yeah.
Yeah. Yeah.
You go ahead.
The number of stillbirths increased tremendously as well. And they tried to cover it up, but thanks to nurses working in such hospitals and also embalmers, we found out that this was happening. And
There's a very important feature to that slide, if I may. Could you go back to it,
mm,
Dr. Anita?
here,
The stillbirth slide.
I have it
No,
on my
yes,
screen, but
there. The the United States does very poorly in maternal and fetal and infant health compared to every other developed country in the world. But still, just considering the United States, if you look at this slide, and I'm so glad you have this here, the line that is basically parallel to the year axis doesn't change. It doesn't go up, it doesn't go down. It's basically a straight line from 2016 to 2020. Without some added factor, it would continue, we can assume, it would continue at pretty much the same rate because unfortunately some babies do die in utero or are stillborn. What we see here is a cataclysm, a line that indicates a cataclysm. There is no other possibility, no other definition for this except a cataclysmic, disastrous loss of life. And the shots are right at that rise. I just want, you know this, of course, I understand that very clearly, but I want to emphasize this for people who might think that this could be coincidental or this could be adventitious and not related. Nope, this slide is definitive. And I just wanted to emphasize how important this data is.
absolutely. I've heard reports of a newborn dying. The newborn was not vaccinated, but the mother was, and she was
Right,
breastfeeding the newborn. It
right,
died from getting the breast milk.
right, right. I'm sorry to interrupt. Well, I'm somewhat sorry to
No,
interrupt
no,
you.
no, it's fine. It's fine. I love your input. So the big challenge, of course, was and still is the secrecy of the manufacture of what actually is all in the vials. And I'm pretty sure we still don't have all the information. Then it was difficult, especially in the beginning, obtaining those vials with a documented chain of custody. And thankfully, La Quinta Columna were the first that were able to do it. Then there are technologies in there that are not out in the open. So many people will just say, oh, that's not possible, that doesn't exist. Well, we need to know technology until it comes out into the open is sometimes 30 years old. So there are hidden technologies that they just keep from the population. And of course, the researchers and the manufacturers wanted to hide the research data. And thanks to a judge, they were forced to release an amount of papers every month. And then there are substances in there that have never been used in humans before. And then the last challenge is that these findings were done by independent researchers that don't necessarily have access or the funds to expensive laboratories, because expensive laboratories are usually funded and located in large universities or pharmaceutical companies. So it was really difficult getting lab testing done for most researchers. So despite these challenges, there were, or still are, 26, probably more meanwhile, research teams on all continents that did examine vials. Besides La Quinta Columna, there were 2 Argentinian researchers that confirmed the presence of graphene oxide, for example, and others who researched the blood of the Jap people. And they used methods just as optical microscopy, dark field microscopy, which I've been using myself, phase contrast, electron beam microscopy, and UV absorbance, fluorescence spectroscopy, and other such methods that they did have access to. So graphene oxide, as I said, was discovered first by Dr. Campra of La Quinta Columna and was later confirmed by others. Then they also found that some vials did not contain the basic building blocks of mRNA, like phosphorus or nitrogen. So we have to ask ourselves, okay, not all of them contained mRNA or the DNA plasmid. So were they just a placebo because they couldn't afford to put this in all of the vials? The death count would have been much, much higher and the disabilities. Or did they just contain graphene oxide and who knows what else? Then the first microscopists, like Dr. David Nixon, Australia, started discovering the nanochip-like structures in the blood, and I believe also the vials, and he saw that they assembled themselves, especially when they were exposed to electromagnetic frequencies. And Dr. Anna Maria Mihalsha, she has been doing a lot of dark field microscopy on her unjabbed patients, finding stuff in there that does not belong in human blood. Then we're finding crystalline structures, laminar objects, sharp-edged shapes, tube-like structures, microbubbles, metallic objects. Someone found parasites, and I'm not sure if that was true. And the mass spectrometry that was done found toxic metals like aluminum, antimony, barium, titanium, cesium, gadolinium, and also some lanthanides, which I'll come to a little later. So here are some images, images from La Quinta Columna and also Life of the Blood, which is an anonymous research group. And they do look like microchips. Here is some more by Dr. David Nixon. Shimon Yanovitz is an electrical engineer in Israel. He did some great microscopy works, and I'm going to go into part of his new publication that just came out that he sent me about a week ago. Dr. Nagaze did some spectroscopy of Moderna and Pfizer vials, and he's the one who saw there is no trace of nitrogen or phosphorus. So those vials did not contain any mRNA or DNA. And these are some structures that I've been finding in patients' bloods. And the scary thing is, this is not only found in the blood of the jab, but the ones who did not take any vaccine have this too, meanwhile. So there is shedding. And I believe it's also from the environment. I have tested rainwater under the microscope and found such structures. Then I have well water in where I live. So I tested the well, which was clean, probably because it's being filtered through the soil levels. And then also I have a whole house RO system and I checked that water as well. It's clean as well. But the rainwater does contain these things. I tested some Fiji water, which had this strange kind of thing, looked like a hydrogel, Pepsi. Then here's the rainwater, Red Bull. So we're finding it in various drinks, but also in food. Then that's in blood. This first image here is a factory that's being built for the self-assembly, and the bright colored dots are quantum dots. And we see a neutrophil to the right of it trying to attack it, and they are pretty much always for naught. The neutrophils have no chance against these structures, so our immune system can't really do much about it. And here's a video, which I don't know if it will play. All these dots here are quantum dots that go across the slide here. Then here is a person I examined a couple of months ago. You don't see an image too well, but there's a lot of yellow, and usually yellow in dark field microscopy means the presence of toxic metals. Then, of course, we have this long fiber with quantum dots inside, which is a factory. Then Italian researchers examined the blood of over 1,000 people, and 12 samples were taken for patients before and after vaccination, and they found that over 94% had abnormal blood. Like here we have healthy blood, and then on the right side we have the blood of a jabbed person. Um, and the difference, I think, is clear. The red blood cells, they conglomerate around some crystalline exogenous particle, this white thing here, they clump together. Um, so, yeah, people who got the jab mostly are not healthy. Their blood's thick. Here again, we have left normal blood, and in the middle, we have rouleau formation. Now, this can happen with just being dehydrated or with too much EMF or dietary issues. But then to the right, we have those crystalline structures again, tubular structures, and fibrin that can form around it. And this from an 84-year-old woman who was living unassisted, was 5 years cancer-free. She developed a skin rash, drug-resistant muscle pain, burning mouth, dermatomyositis, and her cancer recurred, and she was no longer able to live alone. This was a physician in Italy himself who was forced to take the jab to continue working. After the jab, he developed episodes of palpitations. His blood was coagulating more. And then he developed platelet aggregation deficiency, so bleeding issues. And he had disabling headaches. He couldn't concentrate. He got tinnitus on both sides and arrhythmia. And here too, we see those crystallized structures and the red blood cells. Yeah, they are not that free flowing. Then the symptoms, of course, one is death, but the disability symptoms, they concern almost all organ systems. The cardiovascular system, which became pretty famous, the myocarditis, but also people falling over with heart attacks, stroke, pulmonary embolism, or they have blockages in the blood vessels of the eyes. They're suddenly blind, or the ears, they can't hear, or they need amputations. And there's many who suffer neurological issues like seizures. They lose control of their arms and legs. They get Bell's palsy. They're paralyzed, have Guillain-Barré syndrome. MS flares up, and something that's very common is brain fog. Go ahead.
Uh, Dr. Anita, it says low network bandwidth. I don't know if that's you or me, but
I'm on a cabled internet. I'm not on Wi-Fi, so usually it's not an issue with me.
okay, so it must be mine. Could you back up and talk about this slide again because you froze, at least on my screen.
This one?
That one, no, the one that has the death and disability symptoms. The next one.
Well, that is okay. Death and
Yes.
disability symptoms. Yeah.
Yes.
You see it? Okay.
Yes.
So yeah, this the cardiovascular system, the neurological system is affected. Parkinson's seemed to appear more frequently after people got the jabs. Then, of course, we have massive fertility issues in men and in women, and they found out that the so-called spike protein of the jabs, they also preferably go to the gonads. Then, if you have a cardiovascular issue, yeah, impotence, and then the massive loss of life of unborn babies. Then the other thing is the immunosuppression, the turbo cancers that started showing up and still going strong. And I think, unfortunately, most cancers will not be attributed to the jabs that they got. They will just say, oh, well, yeah, it's another cancer case. The difference of these cancers that some oncologists do point out is they grow much faster. I had a friend of mine who I haven't had contact for a while during COVID. He took the jabs. He was diagnosed with cancer in December. He died the end of January. So it's really turbo fast.
Um, I'd like to point out that at least as I think about it, it's not necessarily a difference in the cancer, it's a difference in the immune response, the immune surveillance, and the immune opposition to the existence and the metastasis and the um, uh, growth of the cancer is basically knocked out. You showed the neutrophil not being able um, to do much against the factory structures. I think the entire immune competence level is so damaged that the cancer is basically unopposed. Thus, the turbo um, clinical course. That's how I understand it. If that's not correct, please
Yes,
help
no,
me
you're
understand.
absolutely right. The immune system is overtaxed trying to get rid of the stuff in the blood, and it's no longer able to do anything else. And that's why they also call it VAIDS, vaccine-induced acquired immune
Right.
deficiency syndrome. Absolutely.
Yeah.
Here's a case of out of control lymphoma from Switzerland, where we can see the before lymphoma, and then they got a vaccine booster, and the lymphoma just exploded. It's a massive progression.
This is about 3 weeks,
Yes,
22 days. That's pretty impressive.
yes. And then, of course, we have some cases with dermatological symptoms like peeling off of the skin, burning, and blistering. And some people develop autoimmunity like Graves' disease, arthritis, and who knows what else. And then there's a spiritual implication as well. There was a group of energy healers, massage therapists in Switzerland, Germany, and Austria who got together and wrote reports of the difference they saw in their clients before and after the rollout. And they saw there's a disconnection from the higher self, from spirit. The heart's closed, people were no longer able to meditate. They lost their critical thinking skills, and they have personality changes. They lose empathy and loving feelings. And during treatments, they sometimes saw like the energy body being next and not around the client. And it was like blocking the energy healing modalities that they were trying to do. Massage therapists said the tissues, they became like artificial tissues. It's no longer like live tissue. So I think I'll go into that a little later from what they found.
Let me just inject a comment, if I may. If you look at the news cycle, now the news cycle is manufactured, of course, but if you look at the news cycle, the reports of crimes and the types of crimes that we're seeing are ha- are commonly irrational, horrible, um, meaningless assaults on property, on people. Passengers on airlines are suddenly standing up and trying to open the door to get out, or are attacking other passengers in a closed space. And what you see is an increase in disconnection from any social context and the violence that accompanies that. It's quite remarkable. If you look at the crime reporting of 5 years ago or 7 years ago, and the crime reporting of what you see today, there is a behavioral change of, I think, vast dimension, which speaks to that last column that you spoke about.
Right, the spiritual disconnection, which is one of the agendas behind the whole thing.
Absolutely.
Then the other thing is the other agenda is, of course, total control of thoughts, emotions, and actions,
Right.
which is why they are actually building those self-assembling communication devices in the body. So we don't know, are they already testing this system? And certain people are being influenced by information directly transmitted into them to
It's
do.
my working hypothesis. I don't have the data to confirm or falsify it, but it's my working hypothesis that once injected or sufficiently shed upon, the information, the radio frequency, non ionizing radiation information flow is tremendously enhanced, and the impact is tremendously enhanced. And so, what we're doing is creating receivers for toxic and um, terrifyingly controlling information, biological and psychological and emotional.
Exactly, yes. And the published paper by Shimon Yanovitz goes into the
Right.
detail of how it's being accomplished. I don't really have this information at PowerPoint yet because it's brand new, but I just wrote a Substack on it. It's coming out next Friday because the paper is full of medical and also engineering terms. So it's not that easy to understand for everyone, but people should get the gist of it if they read it. So I try to summarize it in a little easier words.
Thank
And
you.
as I said, next Friday it will be out. And
Shimon Yanovitz is a friend, and I respect him greatly. I trust his work and I trust his discernment very, very highly.
yes, I think it's a seminal paper. It's really the first paper I've seen that really goes into the detail of mechanism involved to construct these communication platforms within the body, and then also goes into why the agenda, what is being used for. I think it's one of the most important papers published so far. So the FDA did their own surveillance and they found out all these problems that were being caused by the jabs, but they tried to hide it. This was a PowerPoint slide that was up for maybe a second. I was able to screenshot it. So as we've seen, all these neurological, cardiovascular, and other issues that it's causing.
And if I remember that slide, that's not the complete list. There was more, if I
Oh yeah,
remember.
absolutely,
Yeah.
yes. So what is it doing? Well, the shots that do contain the mRNA, and we also know tons of DNA plasmids, we know they can penetrate the nucleus and be integrated into the genome. So it's not only that person that is affected, but future generations as well. There's also been several people around the world who have been measuring MAC addresses coming off of people who were jabbed. And
Well, and their corpses.
yes, those two, right. So there is self-assembling nanocircuitry inside the body that can receive and emit signals, altering thoughts, emotions, behavior. So basically, it's turning people into the Borg collective, as portrayed in Star Trek. They're creating a hive mind. Then we had embalmers that started pulling out those white clots. They call them calamari clots. And they're not blood clots. They do not consist of blood. Now, Mac Adams did mass spectrometry on them, and he found toxic metals besides some other elements. Iron that was 200 times less than found in blood. They are very rubbery. They're almost impossible to destroy. I know Dr. Anna Maria Michalska, she tried the most caustic stuff on them and she couldn't get them to destroy. Not that we could use those on patients, they would kill the patients. It's stronger than Kevlar. Then doctors that do EBU treatments, they are pulling clots out as well. And doctors who pull out blood, like say in a 20 cc syringe, and they let it stand for a few hours or overnight, they next day they find the rubbery clots forming in that syringe. They wash off the blood off of it, and they're yellowish, whitish, and very rubbery. So yeah, what's in those shots? As I said before, graphene oxide, and there's lipid nanoparticles, hydrogels. There are different polymers, toxic metals, and the mRNA was told to us is to code for the spike proteins. Our immune system can learn to attack the virus, blah, blah, blah. I'm of the opinion the mRNA, yes, is coding for some kind of foreign protein, which I would not define as a spike protein of a virus. And the DNA plasmids, which they told us, oh, it's just a manufacturing mistake. I think Dr. Michalska had a geneticist look at the DNA sequences and found it codes for spider silk. The spider silk can be made artificially, and it's a very strong material and can be used for optical information transfer. So now the graphene is made out of carbon atoms, and it's so thin that it's considered two-dimensional, and it's also one of the strongest materials in the world and very conductive for electricity and heat. So EM conduction is absolutely possible, which you would need for a receiver transmitter. It comes in different forms. It's used in nanoelectronic devices, receivers and transmitters, and sensors, for cell imaging, for drug delivery. And it goes everywhere in the body. It passes through the blood-brain barrier, the placental barrier, the lung and testicular barrier. And it kind of depends on the method of administration of where it can be found, but it's found in lung, liver, spleen, bone marrow, blood vessels, basically everywhere. It penetrates cell membranes, it penetrates the nucleus and the mitochondria and causes massive damage while doing it. It physically destroys cell membranes. As I said, it acts like razor blades. It's a massive, massive free radical. It breaks down the cell membrane lipids. It breaks DNA. It mutates it. It fragments the chromosomes. It denatures proteins. It attacks the mitochondria, so they no longer work right. So we've got the brain fog and we got the massive fatigue. It causes aging if you survive it. It's a mutagen, it's carcinogenic, and it reduces the antioxidant glutathione, which is the main antioxidant in the body, within really minutes of being administered. And it causes massive inflammation. The cytokines go up like crazy, and it activates an immune response, which is what we talked about before, which has no chance of doing anything. It just tires out the immune system, and the immune cells are being destroyed by it. And it causes cell death and necrosis, and it has epigenetic effects through the gene alteration. It can form large aggregates, blocking blood vessels. It causes platelets to aggregate, causing thrombi, blood clots. It retards brain tissue development in the fetus, and also the blood vessel formation in the heart of the fetus, leading to hypoxia. So I'm sure one of the reasons for all these stillbirths. It leads to abortion and death of the mother in pregnant mice. It causes hemolysis. It's toxic to the lymphocytes. It changes the cell's morphology and decreases the gene expression responsible for structure and function of cell membranes and the regulation of the cytoskeleton. They found in test tubes colon cancer viability improves with graphene oxide. Again, something that is involved with the cancer. And it affects locomotor activities and neurological symptoms like balance, neuromuscular coordination, and it causes electrostatic interactions with red blood cells. Hence, we have rouleau formation and aggregation. Then this spike protein, as I said, not all the vials contain mRNA, so not all the vials will have the effect of coding for some kind of protein. But the DNA plasmids that were discovered do code for proteins as well. And they are foreign to the body. And again, they activate the immune system. And the cells who express those foreign proteins will be attacked by the immune system. Basically, it's an autoimmune disease. So Professor Sukharit Bhakti was one of the first ones to say, if endothelial cells in the blood vessels express those proteins, they will be attacked, destroyed, by the immune system. And then, of course, you have the body that has nothing else that it can do about it but put a plaque on it, leading to massive atherosclerosis. And this is one of the issues I've seen recently with people doing Plaquex for atherosclerosis. They do the treatments and they don't get better because they either got the jab or they've been shedded on like crazy, and they're producing these foreign protein, and the damage caused to the endothelial cells is just faster than anything can help. And of course, it leads to a compromised immune system. And as I said, the DNA plasmids possibly code for spider silk and may also suppress the oncosuppressor genes. Then there are lipid nanoparticles. We're told, oh, they're just to wrap around the mRNA to transport it into the cells. They are spherical vessels. They're pretty small, and they insert themselves through the cell membranes into the cells. And a recent paper, which I will put out on Substack as well, found that it replaces the regular normal phosphatidylcholine in cell membranes with that altered phosphatidylcholine of the lipid nanoparticles. And it causes a change in cell communication and cell signaling, causing massive inflammation. Now, hydrogels have been used in regenerative medicine to build scaffolding, so they can build a support system. And they respond to external stimuli like temperature, pH changes, light, magnetic, and electric fields. Again, we have the transmitter and receiver system here that is being constructed with the hydrogels in combination with the other ingredients. And then some of the scaffolds contain graphene oxide, and they can absorb water up to several times their weight and swell and take up the shape of the vessel they are in. So they're probably a part of those calamari clots. And as I said, they integrate into the cell membrane and change the signaling pathways to cause massive inflammation and metabolic dysfunction. This was a recent paper put out by Stephanie Seneff and other researchers. Then they call them smart hydrogels. As I said, they can perceive chemical, physical stimuli, make significant response behaviors. They are self-adapting, scalable, communicating sensor platforms that are capable of autonomous and or cognitive action. This was found by Karen Kingston in the patents filed for these. So again, we're back to the transmitter and receivers of information. There are long-chain polymers that do not degrade in biological environments. So I'm pretty sure those calamari clots belong to that category, and they stay in the body. Some polymers that were found were polyamides that we would find, for example, in silk, like spider silk or nylon, polyvinyl alcohols, which is plastic, and polyacrylates, which is used for superglue. Now, white blood cells, they do aggregate around it, as I've seen showed in one of the images, but they have no chance of breaking it down. They usually die when they try to do it. So no one knows how to degrade those. And here we have the MAC addresses found by Dr. Luis Benito. He's a doctor in Italy, I believe, who tested people coming to his office, and the vaccinated had a MAC address and the others didn't. So they are building a transmitting ID system linking everyone. Then there is studies on the Internet of Bodies, which uses the MAC approach for a wireless body area network. And the idea put out officially is, oh, so we can monitor vital signs of patients, et cetera, et cetera. But there's a much more nefarious reason behind this. Then there's patented abilities of the lipid nanoparticles. As I said, they can execute actions like creating, spawning, comprising, modifying, repairing, regenerating, reassembling, and control and regulation of one or more cells or cellular elements or even the organelles. So they can be controlled probably with the information sent over EMF channels. So nanorobots are building nanostructures, and Dr. David Nixon filmed the structures that started developing in the vials under the microscope. And it shows robotic arms being built. And when he removed the influence of electromagnetic frequencies by putting it in a Faraday cage, the self-assembly stopped. So if we could stop the EMFs working on us, we could probably stop the process. But in these days, this is impossible, particularly with the low orbit satellites that are going up by the hundreds and thousands. Then we have Ido Barkelet, who was bragging that they can build nanorobots using DNA origami, which is folded DNA that can carry payloads. They can communicate amongst each other, receive signals from the outside, and follow orders for targeted release of payloads. Then this is an article about self-assembly of those smart nanomaterials that can create what they call mesogens. And the mesogen is a compound that displays properties of a liquid crystal. Dr. Hildegard Stonninger is a world expert in toxicology and advanced nanomaterials, and she explained in her extensive chemical analysis of brain chips found in 2011 in individuals, as well as a research of Morgellons, this advanced nanotechnology. And here are some images from Dr. Anna Maria Michalska's microscopy, fibers and spheres under the dark field microscope. And it was known for the past 17 years, and it was developed by the Chinese Academy of Sciences in collaboration with the Curie Institute in France, co-founded by the usual suspects, the Rothschilds in this case. That mesogens are also found in what they call smart dust, which can be found in military documents that can biosense the environment. They are made of polymers like the polyamides, polyvinyl, the plastics, and the polyacrylates. And artificially created spider silk is a polymer tougher than Kevlar. And they are also considered hydrogels. Now, mesogens are used to build the Internet of Bodies, the wireless body area network. And they are impossible to break down, but they do need, according to what Dr. Mihalsha found, aluminum and barium to activate the polymerization, the self-assembly process. So one of the modalities we need to use is chelation to get out the toxic metals. Then what several researchers found is the self-assembly process uses and harvests not only energy from the body, but also different substrates such as copper, gold, silicon, and various other metals, and possibly zeolites, which is why I would never recommend anyone to take zeolites. And it's really been the plan all along. They've been telling us, Klaus Schwab is just one of them who's been telling us that these technologies will operate within our own biology and change how we interface with the world. Smart dust arrays are full of computers with antennas, each much smaller than a grain of sand, can now organize themselves inside the body. is the fourth industrial revolution. It's not an industry in that sense of materials, it's an industry of harvesting humans. Ray Kurzweil, he said in the 2030s, nanobots in our brains will make us godlike. No, they will not. That's the sales pitch. And then, of course, we have Yuval Harari. Humans are hackable animals. The soul and the spirit of humanity will be a thing of the past. That's what they want. They want to disconnect us from our spirit. And here is the just the screenshot of the article by Shimon Yanovitz in the International Journal of Vaccine Theory, Practice, and Research. And as I said, next Friday, I will put it out on my Substack. Then the ultimate goal, connecting the dots. And I highly recommend the book by David Icke, The Roadmap, that really delves into the different dots and connects them into what the ultimate agenda is. It's the synchronous injection of over 5 billion people with self-assembling nanotechnology and the spraying of our skies with toxic metals and graphene oxide and other things. The deployment of 5G and now coming soon the 6G, which operates in the terahertz range, the towers, the low orbit satellites, the data centers, those are not all separate occurrences. They are all building up to a complete control system. The combination of these technologies leads to the connection of all humans to a centrally AI controlled hive mind, as I said, like the Borg Collective. Everyone will have their thoughts given to them, they will have the emotions given to them, and every smallest detail of their life will be registered and controlled. Oh, no, you can't leave your 15-minute smart city. You can't use your car anymore. Your money's only good within 15 minutes of the place where you live. You must work in this job or not work at all. Who knows? And you will have a pittance of a basic universal income, and it's gone after 30 days if you don't use it up. And oh no, you can't buy any more meat this month. You already had your allowance, etc., etc., etc. So it ultimately not only is an inhumane agenda, but I think it is a non-human force behind it that wants total control. And we really are not humans. We are unlimited consciousness awareness. And we can reconnect with that and free ourselves from this dystopia. And they know this. And that's why they want to disconnect us from our, let's call it higher self, from our spirits, from the divine source. That's why they're building this hive mind technology.
Absolutely. Fluoride didn't work. Fluoride calcifies the pineal gland, and it was a good try, but it doesn't seem to get enough um, universality to the effect. So they have to do more things.
Right. And they use the cesspit of Hollywood to create predictive programming. Number one, and maybe there is some high reason why they need to tell us, and if we don't oppose it, it's taken as our agreement with what they're doing. And Hollywood has been putting out movies showing these things years ahead
Right.
of time.
Absolutely.
Yeah, and then of course the toxic metals, which I already mentioned. So one of the treatment modalities will be chelation therapy. So mechanisms of damage and treatment options. The graphene oxide, we went through that, everything that it does. What can we do? Repair cell membranes, mitochondrial membranes, decrease inflammatory cytokines, help the cells make more glutathione, reduce platelet aggregation, improve mitochondrial health and liver and kidney function by the Plaquex. And then, of course, we have the EDTA chelation to remove the toxic metals. And then methylene blue in a very controlled, short burst way to reactivate the mitochondria once we repair them with the Plaquex. Then EBU, which is extracorporeal blood oxygenation ozonation. So you take blood out of one arm, it goes through a dialytic filter. That's where some of the clots come out. You put in oxygen and some ozone, and yeah, oxygenation is always good, especially for tissue that's been starved of oxygen because of the clotting and the rouleau. It also strengthens the immune system and takes out inflammatory cytokines. But I think the main objective here is really the filtration of foreign substances. And I tried to find a laboratory to send used EVO filters to check for graphene oxide. I can't find one. Oh no, we can't do that. Or they don't even answer your emails. Or they, oh yeah, we could, but then you don't hear anything again. So they've been scared off of doing such analysis. And glutathione as an IV and later on orally to replenish the glutathione that's been depleted because of the graphene oxide is very important. Um, Regenerating the liver, Plaquex is one thing, but you can also give supplements like silymarin, silibinine from milk thistle, vitamin C in higher doses as an antioxidant, and also it's a kind of a chelator. It detoxes some toxic metals as well and supports the connective tissue, including blood vessels. Astaxanthin can help inhibit cytokine storms and protect cell membranes. Then we need to eliminate senescence and dead cells. We can do this with intermittent fasting or some supplements that are senolytic activators. And for the toxic metals, chelation, maybe also some chlorella, spirulina, citrus pectin, or cilantro, which will have to be an ongoing thing, really, because we're being exposed to toxic metals in what they're spraying in the sky and what's found in food and water and everywhere else. The lipid nanoparticles, the hydrogels, again, I believe the Plaquex can help here because liposomes are basically built out of phosphatidylcholine, and there is some talk about it being able to encapsulate foreign bodies in the blood, which makes them bigger, which makes it easier to take them out in the dialytic filter of the EVO machine. And again, also the EDTA chelation seems to have an effect on those, as Dr. Anna Maria Michalsza found. And as much as possible, we should eliminate electromagnetic frequencies out of our life, which is very difficult. You can have wired internet like I do. I turned off my Wi-Fi and just wired it. Keep some distance to EMF devices, and there is EMF protective clothing that you can wear. Then for the spiritual, emotional issues that showed up after the jabs, there are some energy medicine modalities. One is pranic healing. I did an interview with a pranic healer in Switzerland, and there are some things they can do on that level. And as I said in the beginning, I knew Plaquex would help. None of these things alone are enough. You need the combination. Then there is a product from Austria to help repair brain tissue. It's called cerebrolysin. It's hard to get here. I do know one doctor using it in West Palm Beach with great success. It's made of porcine brain tissue. It's basically a cell therapy that you give as an IV. So here is a before and after that Dr. Michalsza did with the Plaquex. We see the hydrogels in this patient before, and she did 2 Plaquex IVs, and we did the dark field microscopy, and they're all gone, and the blood cells, the red blood cells, are much healthier and they're free flowing. Then this is the book that was written by the energy healers in Switzerland, Germany, and Austria. That they found, yeah, their clients lost their connection to their soul, to their higher self. They notice emotions of sadness, blockages that feel like a rejection of the treatment, sticky tissues when massaging. Some said it feels like massaging a corpse. Patients who benefited from certain treatments no longer had a benefit. Craniosacral therapists no longer felt the craniosacral rhythm. The head felt like it was empty. And the brain, including the pituitary gland, felt like was shriveled up. And they sensed a dark being laying on top of their patient, almost strangulating the patient or blocking all functions. And the therapists themselves, after treating them, noticed that they lost power. They were very tired, and their hands became very stiff and painful. And they noticed, of course, like we many of us did, personality changes, capabilities that they gained through a lifetime of learning and experience seemed to go into the background, and old and basic fears, illusions, and fixed ideas showed up. And sometimes they felt like they're alone in the treatment room, as if their patient wasn't there. Some naturopaths
Uh,
said aura of the patient looked torn, and that my pranic healer said the same thing. There are holes in the aura. Um, the color is only gray, and there is no longer protection of intrusive energies. It seems soulless. The life energy is weak, and energetic tentacles can attach to that patient. So yes, that's on the spiritual energetic level. So there's some solutions for that. As I said, pranic healing and also shamanic energy medicine can help with some aspects of it. They can pull out intrusive energies, do cord cutting and things like that. And most of the work, I think, has to be done by the person themselves. They have to recognize what is happening and revise their decision to get the jab on a mental, spiritual level. They need to recognize the evil that was done and then do some energy medicine modalities, start meditating. There's probably some homeopathic and anthroposophic medicine. Prayer is an option. Just trying to live a heart-based life. And then, yeah, the EMF protection. I went through some of that. Turn off your Wi-Fi. Um, get a Faraday cage if you have to use Wi-Fi for your modem. Remove your smart meter if you're able to. I had our local FPL remove it. It cost me $13 extra a month for them to send a meter reader, but hey, why not? Um, and keep all EMF emitting devices out of the bedrooms. At least you have one room in your house without EMF. And don't keep your cell phone next to you at night. Um, then there are orgone pyramids that you can put around the perimeter of your home. And yeah, hoodies, hats, t-shirts, EMF blocking pajamas. And if you have the ability, move out of big cities to the country where there are less cell towers. And then, of course, we have, as spiritual beings, we have creatorship. We manifest. Most of our lives, we manifest unconsciously. So we need to focus a bit more and have a mental attitude, beliefs, and emotional states that do manifest what we really would like in our life and not use fear. Um, and to help with that, again, meditation helps, the heart brain coherence exercises, visualization, Falun Gong, which is a special kind of Qigong. Dale Carnegie said, if we think happy thoughts, we'll be happy. If we think miserable thoughts, we will be miserable. And then there's an acknowledgement to all the people who from the beginning started coming out, speaking out, doing research, providing online platforms where those researchers could speak out. Some of them are,
Outstanding.
excuse
I'm
me?
sorry, go ahead. I said outstanding. Incredibly important information, Dr. Anita. Very, very important. We have a question from Sherry K, which comes from our live stream. I have followed you, Dr. Baxas, and appreciate your work. Thank you. I know Dr. Anna says to use zeolite. I'm a bit confused. Karen, I don't know who Karen might be, maybe Karen Kingston, uses zeolite. Are all zeolites the same, and what do you recommend? And after you answer that, I have some information on that as well. Go ahead.
Well, number one, Dr. Mihalsha does certainly not use it. She and I were threatened with a lawsuit by one of the zeolite companies if we don't shut up. So we're on the same page here. Um, Zeolites, number one, if they come from zeolites are made out of aluminum and silica, and they are really good at binding toxic metals. So if you take zeolite products just like that out of nature, you will be putting toxic metals in your body because nature is full of toxic metals. It's being sprayed everywhere. I have friends all over the planet. They sent me pictures of the chemtrails. Even if it's a farm somewhere in the sticks in Nicaragua, they spray there as well. So you will take in toxic metals if you take in natural zeolite. Then if a company says, oh, we clean them, so there's no longer toxic metals in there, fine, they will probably bind metals. But zeolites are, if they're nano-sized, and they advertise they have nano-sized zeolites, they will not stay in your gut. They will go through your gut, into your blood vessels, into your brain, and they're very sharp little thingies, so they will cause damage. If they're not nano-sized, they're micro-sized, and you have a leaky gut, the same thing happens. And this is why some people have started bleeding from their kidneys using zeolites, because the kidneys will be damaged when they try to excrete those sharp crystals. So just as a whole, I would say, no, I wouldn't use them. And there's one company that did before and after hair mineral analysis, measuring toxic metals. And after the people took their product, the toxic metals in hair increased. Now, I've been doing hair analysis for over 30 years. That means you're putting toxic metals in your body. They interpreted that as, oh, you see, the body's excreting. No, it's not. If the body's excreting, it will be putting it out in urine and in stool, not in the hair. It only puts it out in hair if it is getting more than it can excrete. So
I want to add something to what you're saying. Mike Adams was selling zeolite for a time, and I said, Mike, you can't do that. Zeolite is a generic name for a type of mineral complex. As you said, it's aluminum and silica. And when you swallow that, which is how it gets into the body, it is put into an acid bath, and everything um, uh, similar to zeolite metals and so on have coefficients of dissociation, meaning how easily they dissolve, in this case, in acid, quite a strong acid, because that's what gastric stomach acid is. And so Mike has the laboratory to do the work, and he took the zeolite and put it in his artificial stomach, and he discovered that what was happening was that the aluminum was dissolving into the body. So by swallowing the zeolite compound, you are actually increasing the amount of aluminum, the second most toxic non-radioactive metal known, mercury being the first most toxic. You're increasing the load of aluminum, which crosses the blood-brain barrier and doesn't do a whole lot for your cognition or other neurological function. And you may be pulling out some toxic metals, but there are better ways to do it without mechanical damage, as you've been talking about, because of the actual shape of the zeolite uh, particles, and metallurgical damage or biological damage because of the coefficient of dissociation and the fact that you're actually adding aluminum to your body. So I would strongly recommend never, ever, ever using zeolites, even if they come from deep underground and have not received the toxic spray that's coming down on us from the chemtrails. That's what they are. They are aluminum and silica complexes, and therefore they are not to be eaten.
I agree completely. And I did see some studies where they simulated not the stomach, but intestinal tissue, and found that they do start releasing toxic metals that they had found again back into the body. And that hair analysis after results from that company showed mainly aluminum spiking in the hair. So, yes, you're getting aluminum into your body when you take zeolites.
Yeah, and unless that's what you're looking for, it's a pretty good idea not to do that. We don't use aluminum cooking vessels. We don't use aluminum wrap that comes in touch with our food for these very reasons. Taking zeolite is a way of poisoning yourself.
Exactly.
So, uh, people can reach out to you. Do you do long distance consultations, Dr. Anita?
No, I am not licensed to practice medicine in this country. So I stay away from doing that or doing anything that can be construed as that.
Got it. But you are a consultant for
I'm
at least one clinic. Am I not
Yes, I'm
correct?
the medical advisor for the Doctors Detox Clinic in West Palm Beach, but I do not treat or see patients. I advise the staff, the medical staff, about
Got it.
what to do. So I'm the teacher.
Got it. Very important. Does that clinic do the EBU therapy?
Yes, we do EBU, we do chelation, we do the Plaquex, high dose vitamin C, glutathione. We have a four-seater hyperbaric chamber, and we
Uh-huh.
the machine called Flowpresso that does lymph drainage, which is important to do after doing certain treatments to help the lymph flow get out the stuff.
Right. By the way, I've been a chelating physician for about 1,000 years. I've been doing that for a very long time
Yeah, I've been
because it's
doing
so
it since
important in so many ways.
yeah, I've been doing it since 1995.
Mhm. I I think I probably I'm not quite positive, but I think I've probably been doing it since the 80s. So it's a
I was still in high
tremendously
school then.
what what
I
say
was
again?
in high school then.
Right. Well, when I went to medical school, we have dinosaurs at the door, and we had no electricity. Right. Um, it was a long time ago. Um, this is tremendously important information, and I'm very grateful to have it. At the top of the hour, which was 14 minutes ago, we always stop, or almost always stop, and thank People for People, a truly free speech platform that allows us to um, have any discussions that we wish, bring any information that we wish, and disseminate it freely and without limitation. You really need to support people for people.ning.com. Sign up for a free account. When you hear a show that is interesting or useful or controversial or engaging in any way at all, tell your friends and your social media contacts about it. Send them the link. And by the way, speaking of sending, you can send money to peopleforpeople.ning.com. You can help pay for their internet connection. You can help pay the basic operating expenses. This is your free speech platform. And if you have something important to say and you'd like to do a show, reach out to them and say, hey, this is what I know and this is what I talk about. And that's also a possibility. So I that's the commercial. Please support this precious commodity of free, untrammeled speech for programs like this, for people like Dr. Anita to be able to share what she needs to share for catalytic conversations. Now, we can go on because we've done the commercial, but that's a very, very important part of what we're doing. I wonder before we continue with substantive science-based information, if you would tell us about some of the images that are behind you. They're most intriguing.
Well, on this side are all diplomas and certifications, medical diplomas, chelation diplomas, and I was for a time a FAA medical examiner examining pilots to see if they're
Uh-huh.
fit, which was very interesting. Nice thing about pilots is they really are into preventive medicine because they know they have to be healthy to continue flying. So it was always a joy seeing pilots.
How
Um,
interesting.
yeah. Then up there are my books that I've written. The one that's selling the most is the Plaquex book.
Hmm. Yes.
Then we have on this side, my screen is a Chickasaw member of the Chickasaw tribe because the clinic that we operate is not only part of the University of Spiritual health and sciences, but also it's tribal. We're under the
Oh,
auspices of Chickasaw Cherokee tribe, and everything runs
excellent.
tribal jurisprudence and FDA. You need to yeah, extricate yourself from regular jurisprudence if you are in this space. And then down below is a image that Neil Haig did in England. He has a conversation with you and he has the ability to kind of see what kind of soul, what kind of spirit you are. And he saw me as someone who has been a high priestess during the time of Atlantis. And then next to it is an image of me and David Icke when I went to see him in 2024. And that was a gift from a friend who, a famous Swiss painter and artist of a human with angel wings.
Oh, how lovely. Well, thank you for sharing that with us. As I really am
Hmm.
fascinated by the environments that people create for themselves. So thank you. You have some other areas of very, very significant importance. You held up a book that had the word Plaquex on it, and you've mentioned Plaquex, and it's a massively important topic and massively important molecule. And I wonder if we could talk a little bit about Plaquex.
Of course, let me do the screen sharing again here. And then the slideshow. So as I mentioned in the beginning, whoops, that was wrong from the beginning. As I mentioned in the beginning, how we stumbled on this. Let me go through the history. After my mom had her second angioplasty, we discovered this compound in Germany, which was called and no longer exists, lipostabil. It was discovered and registered with the German FDA in the 1950s to prevent fatty embolism during orthopedic surgery. And then the next 3 decades, they did a lot of studies showing the balancing of the lipids and also the use in atherosclerosis. It spread to over 50 countries, but never the US or Canada. So they have many studies showing improvement in coronary artery disease, peripheral artery disease, liver kidney disease, and many, many more. And then after my mom had her second angioplasty and the angina came back, she was really the first patient we treated. That was 1995. And my sister coined the term Plaquex because it makes plaque your ex. 2007, we had to transfer, well, I fled to Switzerland, let's put it that way, and we had to kind of start over again. We found a compounding pharmacy, which is making it up to this day, Anazeo Health. And it's has spread almost like wildfire, especially the last 5, 6 years. There are almost a 800 clinics US-wide, and there are some international clinics using it. Now, the main focus has always been atherosclerosis because heart disease is one of the main killers. But at its basis, it's a cell membrane therapeutic. So it contains phosphatidylcholine. What is phosphatidylcholine? It's a molecule that has a water-soluble head group, which is choline. It also provides choline for the brain neurotransmitter acetylcholine. And it has two fatty acid chains attached. And there are different kinds of phosphatidylcholines, and that depends on what type of fatty acid chain is attached. The one in Plaquex is both chains are unsaturated linoleic acid. That's why they call it dilinoleoyl phosphatidylcholine, or DLPC. Egg yolk has saturated fatty acid chains attached, and that kind of has a bit the opposite effect of what Plaquex does. And the egg yolk one is the one that's actually her definition called lecithin. What is phosphatidylcholine? It's the basic building blocks of all biological membranes. The cell membrane is a bilayer of phosphatidylcholine molecules, and embedded between those are proteins, receptors, electrolyte channels, and also cholesterol for stability. But it also forms single layers in the stomach to protect the stomach mucosa from the acid. And it's found in the lungs, very important for newborns, so their lungs can expand, they don't stick together, and in the peritoneum, kind of as an anti-glue function. If you use phosphatidylcholine that has unsaturated fatty acid chains, it increases the membrane's fluidity, which is very important to activate immune cells, to have flexible red blood cells so they fit through the tiny capillaries, and also makes the platelets less sticky. And it determines the property and the activity of the membrane-bound enzymes, such as the enzymes that make the antioxidants sodium oxide dismutase, SOD, or glutathione. And in terms of atherosclerosis treatment, the LCAT, L-cholesterol acetyl transferase, which takes cholesterol in plaque, esterizes it, and prepares it for HDL to be taken up and then excreted via the liver. Whoops, what happened? Here. It is very important. Part of the cell membrane is the sodium potassium pump, and it maintains the membrane electrical potential with a charge difference between the inside and the outside of the cell. Now, if you use the Plaquex unsaturated fatty acid phosphatidylcholine, it helps to maintain this negative cell voltage and thus increases what they call the zeta potential, so the red blood cells flow freely and they don't stick together, because it offers stability and improves the effectiveness of the sodium potassium pump. On the left, we see the red blood cell aggregated, and then to the right, they're free flowing. It's because of the zeta potential. And something that many people don't know, and even scientists forget about, it's important for the whole body communication system. Cell membranes are an integral part of that communication system. Dr. Dawson Church looked closer at the structure of the cells in his book, The Gene in Your Genes, where he talks about epigenetics. And he describes a skeletal structure that the cell has. And these structures are microtubules that can be likened to rebars in buildings holding up the cellular shape. They're also called microfilaments, and they are broken down and rebuilt many times per hour. And they found that these microtubules aren't rebuilt randomly, but they are attuned to the energy field that the cell exists in. They are like antennas that can receive signals from the environment, including electrical and magnetic frequencies, and then they restructure themselves according to the signals they receive. And they further discovered a class of proteins, protein sugars called integrins, which connect this skeleton in the cell and the internal organelles, including the nucleus, to the connective tissue outside the cell, which is the fascia. And they convey the information from outside the cell, from the fascia, comes in from the fascia into the cell, vice versa. So this enables instant communication within the body. Because we all know hormones and nerve signals, they are too slow for rapid communication to orchestrate millions of bodily functions. So it turns out this fascia connected to the interior cells via the integrins and microtubules transmit information at the speed of electromagnetic frequencies, even at the speed of light photons. Here is a little image showing the nucleus on the bottom, and then those microtubules going through the cell membrane out into the collagen fibers, the fascia. And biophotons traveling through the fascia to all the cells, to all the cell membranes at the speed of light, orchestrates a harmonic concerted function for the entire body. And in that sense, the cell membranes really trump DNA because they sense the environment, the internal environment, our emotions, our mental state, our energetic state, spiritual, biochemical, individual makeup, and external environment, foods, toxins, predators, social situations, sexual stimuli. And the cell membrane really is a liquid crystal semiconductor that selectively lets in and out substances and signals. So this information transmission throughout the crystalline fascia results in a harmonic resonance of the entire system that can build up to light emissions, information traveling at the speed of light, which was discovered by Professor Fritz Albert Popp. In this way, we are our thoughts. The system enables rapid communication of thoughts, feelings, and environmental signals at incredible speeds into every nook and cranny of our body. So the tissues can act and react in concert to these signals. So every thought we have resonates through the entire connective tissue, the fascia to all the cells, down to the DNA, turning on and off genes. This is why epigenetics works. Um, and that's why they say this, they say you are your thoughts. So what can go wrong when we are exposed to constant EMF emissions or foreign substances in our bodies that receive and emit EMF, as we spoke about before? It causes disharmony in the entire communication system within the body. And as the paper of Shimon said, those artificial nanotechnology devices, they also use light as a means of communication. So they will be interfering with our body's own light emissions. Now, cell membranes are damaged by free radicals, toxic substances, and we've seen graphene oxide, toxic metals, detergents, even mechanical, when you think about the heart catheter during an angioplasty, scratching its way around the coronary. Then, of course, high blood pressure, high levels of adrenaline, aldosterone, and cortisol, in other words, stress, high blood sugar, insulin, smoking, cocaine, and also bacterial lipopolysaccharides. They all cause inflammation. Then there is a breakdown of the repair mechanism. At birth, our membranes have 90% of this polyanenyl phosphatidylcholine, and as we age, we lose more and more until there's only 10% left in old age. And mitochondrial energy is essential for the synthesis of phosphatidylcholine, but on the other hand, the mitochondrial membranes need phosphatidylcholine to work right. So if this system breaks down, we lose membrane fluidity, we lose the enzyme function, receptor function, the waste elimination and nutrient uptake is not as efficient. The membrane loses the integrated cholesterol, which gives stability, and loses membrane proteins. And in the end, the cell's integrity is so diminished, it dies. So phosphatidylcholine is vital for cell membrane and mitochondrial membrane integrity. It lowers LDL, VLDL, and triglycerides. It increases HDL, but never to the point of abnormal. Unlike, for example, statins, you can lower LDL until you're deathly sick. The phosphatidylcholine is more a balancing. If HDL is normal, it will not raise it more. It's not necessary. If LDL is normal, it will not lower it more. And it helps to activate the enzymes for the antioxidants, glutathione and SOD, but also the enzymes to clear cholesterol from plaque. It reduces lipid peroxidation, inflammatory cytokines, platelet aggregation. It increases the red blood cell flexibility and helps immune cells to activate, and it increases the CETO potential of red blood cells. Here's just a few of the studies showing the LDL cholesterol reduction in over 1,000 patients, and it was reduced 10 to 31%. And again, 10% will be in people that have a little bit too high cholesterol, and 31% in people where it's very high. Although I have some issues with the normal values that are used today, they were
Oh,
certainly
the
low.
normal values are insane. They are designed specifically to sell drugs that are designed to produce multiple problems in your body, which can then be treated with other drugs. So I have a lot of problems with the values.
Exactly, yes. I remember the old normal values, and then the statins came out, and suddenly they were much lower officially.
Right, and the values that are considered normal and desirable at this point produce things like significant increase in deaths from all causes, including suicide and homicide. They produce erectile dysfunction. They produce immune collapse. Those little things that people might want to get treated with drugs.
Right, more calcification in the blood vessels.
Absolutely,
The only
absolutely.
time I ever had a so-called normal LDL level when I was deathly sick. It was the,
Yeah. So the whole issue of statins is worth an entirely different
oh yeah,
program, but this is tremendously important.
right. And then the
And
H,
by the way, people who might be working with naturopaths or physicians who understand the importance of phosphatidylcholine um, might know that the FDA, that's the Fraud and Death Administration, is making it incredibly difficult to get phosphatidylcholine per se for infusion purposes. They are restricting its import. You can only get a couple of vials at a time. Very, very important information that you're giving us,
Which
Dr.
is why
Anita.
we have Anazao Health that compounds it locally, but they needed to change the supplier that has an FDA registration number and blah blah. But it is the German supplier, thankfully, that has it.
Oh, it
So
is. Okay.
yes, it
All
is.
right.
Thankfully, it's a bigger company now, and they managed to get registered. So
Well,
that's
maybe you can share that with me after the show or in an email. I would really appreciate that.
okay.
Go ahead.
So anyway, yeah, HDL, they found increases from 10 to 45%. And as I said, very low initial values were raised, while high initial values were hardly influenced. Triglycerides level were lowered, and they tried what works the best, the oral or the IV. And the fastest result was with the IV within 3 months. And it reduces LDL oxidation. They put LDL in different test tubes and added various substances. One of them, the dioleonyl, the Plaquex phosphatidylcholine, and then another with vitamin E and some other phosphatidylcholines. And they found, okay, the one that's in Plaquex really increases the time until LDL oxidizes by 140%, whereas even vitamin E was lower. They did a lot of animal testing, giving them an atherosclerosis producing diet, and then sacrificed them and saw the ones that did receive the phosphatidylcholine had massive reductions of the atherosclerotic plaque compared to the placebo here in pink. And as I said, the importance of this LCAT enzyme is the lecithin cholesterol acetyltransferase, which catalyzes the esterification of cholesterol in plaque, so it can be taken up by the HDL and eventually eliminated. And the unsaturated phosphatidylcholine as found in Plaquex activates the LCAT activity, while the ones found in egg yolk, the saturated one, diminishes the activity. And then other enzyme systems that are activated are other lipid enzymes like lipoprotein lipase, triglyceride lipase, and I already mentioned SOD and glutathione. And I made a cartoon here to show the LCAT zapping the cholesterol and plaque, getting it ready for the uptake of HDL and getting it out through the liver. Here's another animal study. The top one got 2 months of a high cholesterol diet. Now, I'm not saying high cholesterol causes atherosclerosis in humans, but animals, those animals are vegan. So if you give vegan animals high cholesterol diets, they probably will develop atherosclerosis. Besides, they're probably caged, they're under stress. Yeah, their aorta will look like that. And the other animal, they received the same diet, but then they got 2 months of the phosphatidylcholine, and the aorta is clear of any plaque. In humans, they tested how many times they had an angina attack and needed nitroglycerin per week. And after being treated, the amounts went down significantly. They had less angina and obviously needed less nitroglycerin. They did a walking distance trial to see how far they could walk on a treadmill without using nitroglycerin. And the distance was extended from 30 to 50 meters to 3 kilometers. Like almost 2 miles. Then we have some case histories doing calcium scoring before and after. This was a patient that had a before score of 271 and 138 afterwards. So he had a reduction of 49% in the calcium score and 36% in the volume of plaque. There is a patient who has plaque in their carotid artery. With a stenosis of 75%. They had 30 treatments and we got it down to 40%. But then for 1.5 years, the patient didn't do anything and the stenosis went up to 95. So he redid the treatments and they went back down to 60. It's important to do maintenance therapy and also do some lifestyle adjustments. because the process of building atherosclerotic plaque continues unless you change some things in your life. Here's another calcium score patient, total score and number of lesions before and after. He had 30 Plaquex infusions over 4 to 5 months. He had a 58% reduction in calcium score. Now, it has an influence on the platelets and the red blood cells. So if you give a low dose of 500 milligrams, it will reduce platelet aggregation. That's why you will have very fast symptom relief, because you have less clotting. But that dosage is not enough to actually remove any plaque. It removes some cholesterol accumulation in the red blood cell membranes and also platelet membranes by activating the LCAT as well. So that's why those membranes become more flexible and more fluid and deformable. It decreases the cytokines, the inflammatory markers like tumor necrosis factor alpha, the interleukin 6 and 10, and it inactivates the nuclear factor kappa beta and other inflammatory pathways. So it has anti-inflammatory and antioxidative effects as well. They studied it in over 8,000 patients with liver disease, and they saw an accelerated improvement of the subjective complaints, but also of laboratory and histological findings. And the patients had a much shorter hospital stay than the ones who did not receive it. They studied it to see if it can inhibit collagen synthesis and thus liver cirrhosis, and it can. And it also eliminates fatty liver, as they studied it with ultrasound and histological findings. The top here is the reduction of fatty liver with histology showing less fatty globules after doing the treatments. And the lower one shows the FibroScan, which measures the liver stiffness and the liver cirrhosis, showing less stiffness. So it does help to reduce some liver cirrhosis. And it protects the pancreas. They caused oxidative stress in rats with ethanol, and it caused glutathione depletion in the pancreas. The rats that were given the phosphatidylcholine and the ethanol had no such depletion of glutathione. And there are many studies showing improvement in kidney disease. Chronic glomerulonephritis patients showed a reduction in edemas and an increase in serum albumin, so they weren't losing the albumin through the kidneys anymore. They treated children with chronic nephritis. They had a reduction of symptoms, normalized blood pressure. There was less protein being lost in the urine and less white blood cells. And in renal insufficiency, creatinine and urea parameters improved and blood pressure normalized. And we've had anecdotal reports of patients who did the Plaquex for atherosclerosis that were on dialysis, and after finishing their treatment series, they could reduce the amount of dialysis they require per week. And it also is good for the stomach protection. As I said in the beginning, it forms monolayers in the stomach to protect the stomach mucosa from the acid, but it also protects it from the effects of non-steroidal anti-inflammatory drugs. And they found it reduces the ulcer formation in rats. And 65% of patients that took NSAIDs and the PPC, they had much less side effects from them. Then they did studies on mitochondria, which are involved in the synthesis of phosphatidylcholine. So we need healthy mitochondria to make phosphatidylcholine, but we also need the phosphatidylcholine to keep the mitochondria healthy. So mitochondria are damaged, as we've seen prior, by graphene oxides, for example. And alcohol damages mitochondria in the liver. And the activity of mitochondria was measured by cytochrome oxidase activity in rats that were given alcohol or alcohol and different forms of phosphatidylcholine. The one given the phosphatidylcholine in Plaquex, which is the orange bar here, they had a lot less damage, they had more activity. In neurological issues, it was studied mainly in Japan on Alzheimer's patients. They showed an increase in the mini mental state scores after treatment with phosphatidylcholine mixed with palmitoyl POPC. I've been trying to find POPC as a supplement or as a raw product, but I wasn't able to. And they also did a study in rats showing that phosphatidylcholine increases the antioxidant SOD in brains. So we have more antioxidant capacity in the brain. So in summary of effect, it unclogs arteries, it balances the lipids, it improves liver, pancreas, kidney function. It can improve morning sickness and gestosis in pregnancy. It improves psoriasis. That is a Japanese study using just an oral version, and also neurodermitis. It protects the stomach. It improves cognitive function in vascular and Alzheimer dementia. It improves inflammatory gut conditions such as Crohn's and ulcerative colitis. And as we've seen, it's important for the whole body communication system, which depends on healthy cell membranes. It improves and repairs blood cells after the COVID jabs and the shedding, and it may bind foreign substances in blood to detox from the hydrogels once you do the EBU and use the dialytic filter. It's available also in oral form. There are just very few companies that really have the correct phosphatidylcholine in there. If you see capsules with powder, that will not do you any good. It needs to be the DLPC. The difference between the oral and the IV really is the oral is not capable really of taking out atherosclerotic plaque. So it cannot be used to treat plaque and get rid of it, but it does basically everything else that the IV can do, just a little slower. As I showed before, I put everything in a book. Originally, I wanted to write the book for medical professionals, but then I found, I think many patients will want to read it too. So I kept it in a little simpler language. And it is mostly lay people that are getting the book and then finding a clinic on the website to go and get the treatments done.
How many clinics around the country are following your protocol?
Well, there are about 600 clinics doing it, but not everyone follows the protocol, which is the reason why I created an online certification course, because we found out it's a little bit like the Wild West. They use less than what we prescribe in the protocol, probably for pecuniary reasons. It costs them less if they use less, but they still charge the same amount. So I've had about 30 students so far completing the course. And on the website search engine for clinics, the one that did take the course and completed it and passed, they will have a little mark showing that they are certified. But those are still only very few compared to the clinics that exist. But then the course hasn't been around that long.
And the website we're talking about is
No,
anitabaxasmd.com. No?
Plaquex.com.
Oh, Plaquex.com.
Yeah.
Okay. Very important information. Any contraindications or side effects?
The main side effects can be diarrhea, particularly in patients who are severely atherosclerotic and the ones who no longer have a gallbladder. And the main contraindication is antiphospholipid syndrome, which has been so far quite rare. And one question
Um,
that always shows up is, oh, it's made from soy. What if I have a soy allergy? It's not an issue because soy allergies are allergies towards the protein part of soy. It does not contain protein. It's so highly purified. It's only the phosphatidylcholine that's in the Plaquex.
and it's made in Germany or the United States at this point. I got a little confused.
Yeah, the main ingredient is made in Germany.
Okay,
And then it's compounded, mixed together with the other ingredients here in the US. You need
got
to
it.
add some deoxycholic acid to make it soluble.
I got it. I got it. Um, this is very exciting, and I hope people will um, dig into this. Do tell people how they can contact more information sources.
Well, there's the plaquex.com website, which has the book. It has some explanation of what it does. It has downloads for doctors and patients of information and studies. And it also has a clinic search engine where they can put in their zip code and find a clinic near them.
Very important. Very important. And what is your teaching schedule? How do you disseminate this? Is it entirely electronic or do you travel around and
I've
teach
I've
doctors in person?
I've taught and lectured at the A4M, ICIM, and ACAM, and some other infusion seminars. Um, I don't travel to clinics per se. That they number one, I tell doctors read the book first because doctors contact me and they want to know the basics. And there are so many now. I don't have the time to run everyone through all the basics. I tell them read
Right.
the book. If you have questions, send me an email or take my course. And then if you have questions, I collect all the questions that come in for a few months. Then I make a video, a Q&A, and put that on the course website as well. And those doctors, they
Super.
have access to me via email or so sometimes by phone.
And how long does it take for a doctor to be certified in your protocol?
They can take the course on a weekend.
Oh, okay. So it's not like a year long
Oh
kind of.
no, 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 no. There's 6 modules and there is
Okay,
Q&A, so it's maybe 6 hours in total.
got it. Got it. This is very important. Um, have you gotten any negative feedback? Or let me put it the other way. Tell us about the negative feedback.
I I'm usually contacted by doctors when they don't get the expected results. It's rare that I hear the good results, but I do hear them if I ask them for it because for them it's normal, it works, they don't have to tell me. There is, especially lately, I got some feedback. The calcium score didn't go down. Well, there are some issues with the calcium score before and after. Number one, it's not an exact exam to begin with. It depends on the radiologist and the algorithms they use. Number two, if you do a calcium score and then wait a year before you start treatment, you can't use that before because your calcium score probably increased a lot more until you start treatment. And the same goes for afterwards. You finish the treatments and then you wait a year to the calcium score. If you don't change your lifestyle, do maintenance therapy, it will probably go up again. So you can't really compare the two. Then you have to use the same machine before and after. Patients who are on Coumadin, they are lacking the vitamin K, so they build up calcium a lot faster. And then I've had two incidences where doctors told me they sent the patient for an after calcium score and it went down, but the radiologist can't believe that anything can lower the calcium score. And they adjusted something in their programming and suddenly the score was higher without doing a third exam. And then we need to remember calcified plaque is stable plaque. So really the only exam that gives you a better image is the Clearly exam. It distinguishes between calcified and soft plaque. So you really see what's going on. And then, of course, we have the ones that have been jabbed. The damage to their endothelial cells done by their own immune system attacking the protein, the foreign protein they're extruding, is so massive that you're running behind with the Plaquex trying to fix it, and the damage just continues and continues.
What do you know about shedding damage
This
for the
happens.
unjabbed?
Yeah, this happens too in patients who did not get the jabs, but they are surrounded by jab people. So yes, they do shed. And I was recently on a Zoom call with, I believe it was the university. There's a company that developed a test with Professor Koenig in Germany, testing exosomes people breathe out, testing them for the contents of this foreign spike protein. So yes, this is shedding.
That is tremendously important. I would love it if you would make that data available, any papers that you have or information on that. Um, shedding is a very real issue. And with the replicon mRNA jabs, the whole point is to generate as much shedding as possible to inoculate everybody, whether they want to be inoculated or not. Uh,
Exactly.
Terrifying. And let's be very clear. I know you know this, but people need to be very clear about the fact that um, the approval for replicon jabs for pets and for people is proceeding under the current alleged leadership of Robert F. Kennedy Jr. of the Health and Human Services, FDA, CDC, et cetera, et cetera. That's part of the mRNA uh, program, and we have to be very, very aware of that.
Absolutely, yes, because it's hard to protect oneself from shedding. All you need to do is sit in an airplane for a few hours or go to a populated airport. It happened to me when I went to England. I came back, I checked my blood. I had this crap in my blood too.
I when I first got my first dog, I have 3 dogs. You may have seen them wandering around in back of me. When I got the first one, I had made a friend whom I called my dog friend. She was actually fairly boring to spend time with, but she had dogs that my dog liked to play with. And so, in the interests of my dog's mental and emotional well being, I spent time with this lady who assured me that she would never get jabbed because of all the things that I was saying. And this was very shortly after the jabs suddenly, miraculously became available with no prior preparation or patents going back to 2011. It was a miracle. And she assured me that she would never, ever, ever get jabbed, except that every time I went to her home to allow the dogs to play together and spend a couple of hours, um, I would get sick each and every time. And I said, "You either are hanging out with people who have been jabbed or you got jabbed." And she sort of hung her head and had to admit, et cetera, et cetera. So it was quite clear to me that it was a very real phenomenon, even at a time when it was being denied and demonized as a possibility. Very real.
Right. I noticed myself, I have my mom's cousin in Arizona and her husband. Even though I've been warning them from the beginning, they got jabbed and boosted, but I still go to visit them. Every time I get a menstruation, and I'm 60 years old.
Uh-huh. Interesting. Interesting. Well, I'm in Arizona. If you're anywhere near, we should get together.
Oh,
Yes,
where?
I'm in Tucson.
Oh, okay. Been
And
there once 30 years ago.
okay. Um, so what occupies your focus and your time at this point? Are there other areas that you're moving into, or are you focused very much on what we've been talking about?
I focus very much on what we've been talking about, but my time is kind of limited because my youngest sister, as I've said, has Down syndrome and she lives with me. So it's
Uh-huh.
caregiving involved here. Then my other sister and I, we run the company that sells the Plaquex oral and other supplements, and we don't have employees. So
You
we
do it
work,
all yourself.
we do it all ourselves, including
Mhm.
cleaning the toilet. You know?
Well, absolutely. I understand that very well. I have a funny story to tell you. I had been to Russia. I was there both before and after Perestroika. And actually, I believe it was before perestroika, the first no, it was after perestroika. I was in my office. The office hours were going to start in about an hour, and so I was cleaning the toilets. I had rubber gloves on and I had a bucket, and the doorbell rang, which was a little puzzling because none of the employees were there and there were no patients scheduled. So I went to the door, and there was an FBI agent who showed me his badge and handed me a card. And I reached out my hand to shake it, but it had a yellow rubber glove on it, so I took that off. And he said that he was doing counterintelligence and he wanted to know all of the people that I had contacted or had conversations with while I was in Russia, which I thought was rather interesting because I hadn't told the FBI that I had been to Russia. And I said, "So you're my private FBI agent?" He said, "Yes, ma'am. And I would like to know all of your travel plans for the future." And I said, "No." No, that's not happening. But
We don't
so
live in Russia, right?
what? I'm sorry?
We don't live in Russia.
Yes,
That
exactly, exactly. I think you're in the wrong country on the wrong continent. And so, when you said including cleaning the toilet, that's what immediately flashed into my mind. Um, so you, uh, you make the Plaquex oral available to people as an oral supplement on their at their discretion, but the injectable, I'm assuming, is only available to physicians and clinics?
Yeah, it's only available to physicians, and Anazao Health makes it. So we're not really involved in all of that. It's their business. I'm just the teacher for it. And the
I
plaque
see,
extract is used for maintenance therapy once they complete all
I
the
see,
activities,
see.
or also non-IV dyes, or patients who want to use it preventively or have some other issue with liver or kidneys.
Yeah. Um, I practice and have for my entire career what I call couldn't hurt medicine. Let's try this. It couldn't hurt. And I want to be very clear with everybody who's listening and everybody who comes to this recording later. Um, Phosphatidylcholine, especially unsaturated phosphatidylcholine, is a wonderful, wonderful example of couldn't hurt medicine. It does wonderful things to the body across multiple systems. And so, if you have questions about whether this might be useful for you, given whatever medical thing you have or want to prevent, or genetic tendency or whatever, this is the kind of option that literally falls into the couldn't hurt category. And then for infusions for more serious um, medical treatment, that's when you need a knowledgeable person who has experience with it and can be uh, a health guide and advocate, which is what I believe physicians and health providers need to be. It makes me quite crazy when somebody said, for instance, I saw somebody Friday, yesterday, and he was on a cocktail of medications for sleep and anxiety and this and that and the other thing. And I said, does it help? And he said, no, not really. And I said, well, why are you putting these chemicals in your body? Why are you taking these things? And he said, well, I don't want to hurt my doctor's feelings. And I immediately thought, where do you find patients like that? I've never had a patient like that. Is there a slot machine where I could find them? So it's not about your doctor, it's about you, of course. And I think anybody who comes to this kind of program knows that already.
Absolutely. What my dad always practiced, even is patients came with hordes of medication. He said, okay, let's leave all of these out and let's start from the beginning. What's your
Yes.
problem? And then they come with a list. Give me that list. What is your problem? Now or yesterday or maybe 2 weeks ago, but not a list of every tiny little symptom you've had the last 5 years. And then he would start them on what they really needed to keep them fine for the moment, and then put them on nutraceuticals.
Yes. Um, this is much like the thing I did whenever I got hold of an institution with people in it. For instance, an inpatient unit or an outpatient unit where I was serving as the director, um, in order to see what we had. And these were psychiatric facilities because that's my specialty. um, I would discontinue carefully, discontinue everybody's medication because otherwise I couldn't tell what in the heaven's name was going on. And of course, this made the administrators and especially the financial people crazy because reimbursement is dependent upon medication, to which my response was, deal with it. I don't care. because you can't tell what's going on when what you're looking at is side effects of medication.
Right. Or maybe intoxication with toxic metals.
Right, very much so, very much so.
Yeah.
Yeah. Well, this has been a wonderful opportunity for us to get to know one another. I have indeed followed your work for some time, and you commented on one of my Substacks, and I thought, ooh, ooh, I can probably reach this lady, and we can probably have a conversation. I'm so pleased that we've done so, and I hope you will come back and we will continue this conversation. And I'm going to um, uh, ask you if you will send me a copy of your book or a PDF so I can read it in detail. I would be very pleased to do that.
Of course. I'm very honored that you responded to my comment and asked me on to your show. Really, it's been a real honor. And
Thank you.
of course,
Thank you.
I'll send you my book. Just email me the mailing address.
Okay, I will be happy to do that. Thank you so much, Dr. Baxas. It's been a delight listening to you and learning from you.
Thank you for having me. One question: where
Yes.
will this be a video that's online somewhere so I can link it from myself?
Yes, this will be on the People for People, People FOR People 20 it's PFP 2022 on Rumble, but I will send you the link.
Oh, yes,
It'll
please.
be up shortly after this. And what
Oh, okay. That'd be great.
as a
I
matter of fact,
have to,
if you'll just put your address in the chat here, then Gaz can send it. Thank you, Gaz. There is one final question. If someone tends to have lower platelets, would the oral Plaquex cause the platelets typically to go even lower? Thank you so much. Appreciate this presentation.
no, it will not lower the amount of platelets. It just makes them a bit less sticky, but not to the point like, for example, Plaquex. So you will not have issues like you're suddenly bleeding, and it will not lower them. It just lowers the stickiness.
One of the things we didn't talk about, to take another minute or two of your time, is that this substance acts very much like an adaptogen. If something needs to go higher, it helps it go up. If something needs to go down, it helps it go down. The most remarkable and the most helpful substances act as adaptogens, helping the body regulate itself to get to where it optimally wants to be for homeostatic purposes and function. And this is one of those remarkable molecules that does that.
Right, because it helps the body to be in a healthy state regarding cell membrane. So they do what they need to do to be healthy. And it's not forced
Exactly.
to something like statins, for example.
And pharmaceuticals are not adaptogens. Pharmaceuticals basically push a biological or biochemical function in a particular direction, whether or not you need it, whether or not it winds up being helpful for you. That's the difference between That's one of the differences between natural methods of assisting the body mind unit in doing what it needs to do and forcing it with essentially intentional poisoning. I am, Dr. Baxis, as you may know, a physician who's never written a prescription for a pharmaceutical in 56 years. So, I'm pretty stubborn that way.
Great.
Excellent. Thank you so much. What a
Thank you.
pleasure.
Absolutely. Thank you, Dr. Rima.